back to the D&E Unfiltered channel.
Thank you, Miss Director. We have been reading all your comments, and thank you very much. We do like to read anything and everything everybody has to say. It's very important to us that we get some feedback, that we know that we're at least putting something out there that somebody wants to hear, and that, you know, if you've got a question, comment, please feel free to give it.
Yep.
We read them all. That being said, there was one question that came to our attention that we thought we would address, and that was, what led up to me needing a hip replacement? I'm a very athletic, outgoing type individual. I enjoy sports of all kinds from the age of 5 to now. And so being very active and being very, I'm not gonna say I'm a great athlete, I'm just saying I like to play sports and feel like I'm decent at it and enjoy playing it, love the team aspect. Played a lot of baseball from 5 till just a couple years ago. Played a lot of softball, a lot of basketball. All those type things have a tendency to wear and tear on your knees and on my hips. About 5 or 6 years ago, I went to Orlando Orthopedic to have them take a look at my rotator cuff, which I was having issues with from all the throws that I've made over the years from baseball and softball. While I was there, I mentioned to my orthopedic that my hip had been, you know, not necessarily in pain, but had given me a couple twinges recently, and would that need to be something I need to look at? So he did some x-ray and discovered that I had arthritis and bursitis in my hip. His direct words to me were, "You are eventually going to have a hip replacement." Well, at 54, 55, I'm like, I don't know about that. So I listened to what he had to say, took in the words, but didn't let it hit home. Came home, told my great director, E here, what was going on. We did a little research, and in that research process, we read that hip replacements at that time, if you had it done, you were eventually going to have it redone within 12 to 15 years. Well, in my mind, I'm thinking, I'm only 54, 55. I want to have this done again at 70? So I said, I don't know. I don't think so. So I continued to play sports and do my thing. And then a few years later, when talking with my orthopedic, I was prescribed cortisone shots. And baby, those were magical. Loved the cortisone shots at first. I was getting them about 3 times a year, made my hip feel great. Felt like I was still as athletic and positive as I was before the injury or before the shots. But eventually, after a year or two, they did warn me this was going to happen. They started to wear off a little bit, and I had to start getting the shots quicker and sooner to where it was 4 times a year. And when it got to be more frequently like that, my wife, doing her research, great job that she does, saw and found out that this was not necessarily good for your kidneys and liver. So I decided that I was going to wean myself off and not take the cortisone shots for my own benefit for later on in life. I didn't want to have kidney or liver issues or anything.
It's not good for you overall.
Overall,
plus,
it's not
the insurance will only allow it for so much in a year, and it's not good for you to rely on it.
So decision was made to just decide to stop taking the shots. At that point in time, I noticed that the pain started increasing more. At first, it was just like toward the end of the week kind of thing after a long, hard week of work. With my current job, I walk anywhere from 7 to 10 miles a day. So toward the end of the week, I was feeling it a lot more and more. At this point, I went back to the orthopedic and started discussing what was going on. And he basically told me, look, we told you this is going to happen. You're going to have it replaced, but it's going to be up to you. Whenever the pain is more than you can tolerate, When you've had enough of it and you're ready to replace it, that's when you'll have it done. So I feel like, this may not be true, but this is what I like to think, I've got a high threshold for pain. I seem to have had that most of my life. And whether it's true or not, I think it's true. So I endured for a few more years of this, and we continued to follow the research and see what was going on in the field of hip replacement. And finally, I felt like the technology had caught up to where we are now, and I felt more comfortable with getting this process done. In our research, we found that hip replacements don't have to happen again. You can get it done once in your lifetime, and they can last the rest of your life. This was more in line with what I was thinking and what I wanted to have happen. I didn't want to have another surgery later on in life. So at this point, we went back to Dr. Davis at Orlando Orthopedic, Dr. McDreamy, according to her. And we told him, hey, we're ready to get this thing done, and started planning it about 6 months ago. I noticed my gait was getting a little bit shorter, and through that course of time, the pain would increase, to the point of where when I get home, I'd have to collapse on the couch. So that again was a large determiner for the fact that I needed to go ahead and get this done.
Yeah.
So
it's nothing to do with your golf score?
I would love to blame my golf score on my bad hip. Believe you me, if I could, I would.
You mentioned your
But
golfing.
I'm not a very good golfer to begin with. I just enjoy being out there with the guys and having a drink on the course and being outside in the beautiful Florida summer and spring and fall. And it just is enjoyable.
So that's the reason.
That's the total reason. That's a great question. We appreciate you bringing that up.
Yeah.
Again, I'd love to blame my bad golf on my hip, but no, it's just me. I've got the baseball swing, and I played Army golf. Right, left. So that's it. Again, thanks for the comments and the questions. Please feel free to say anything you like, ask us anything you want to know.
Yeah.
We'll try and respond to anything and everything.
And let us know what kind of video would you like us to do.
If you have any suggestions for that, please feel free.
Challenge him.
We'll take it. Thanks a lot. Have a great day, and we'll see y'all again soon.
That's a wrap.
Yay!
Thanks for watching, guys. Please subscribe, follow, and share, and make sure you click that bell button so you can get a notification when we upload a new video. Thanks again. Be safe. Bye.